Welcome to Focus on Health, a series of educational programs highlighting current health issues sponsored by the Department of Nursing at Salisbury University. I'm Dr. Mary DiBartolo, Professor of Nursing at Salisbury University and host of the program. I welcome back today, you've been on the program many times, Dr. Chris Snyder from Peninsula Regional Medical Center. And what is your official title now?
I'm Chief Medical Information Officer. I'm also a hospitalist, so still practice at Peninsula Regional.
Very good. And of course, you've been a physician for many, many years, and a local product. You went to Salisbury University initially, and it's so great to have you back. And you do many important things in the community and at PRMC with the information technology. So what better person to have come in to talk about this topic called, well, we're going to address it in terms of using the internet and self-diagnosis. There's pros and cons, and we know it's happening, and probably the numbers are lower than you would think.
Yeah, I think there's probably an underestimate of how many people actually ping the internet for medical knowledge, whether it's before they come see me or after they come see us. So, but there's some good and bad things about it, just like everything.
And we'll get to that. But I did want to mention these numbers, and you're saying they're low. I looked at the Pew Center, who did some statistics on this, and they said 59% of people look up healthcare information online. 59%. Yeah. 35% of U.S. adults use the internet to actually self-diagnose, to come up with a medical condition that seems probable from their symptoms. You say that's low.
Yeah, I think it's probably low. We see a fair amount of people bring in things and information, and again, we try to encourage good things. But
do they bring in printouts and things?
Yeah, oh, absolutely. Printouts, or they'll show it to you on their phone. Yeah, some of the obviously younger, but I'm even seeing a lot of the folks over 65 who really are getting involved with smartphones. Their daughters and granddaughters and grandchildren are helping them. But yeah, it's
these baby boomers, huh?
Absolutely. Yep, it's definitely changing.
A couple other numbers I'd like your opinion on. It says 82% will start by using Google, just some general search engine, and then 13% goes straight to WebMD or some similar site like that. And the good news, I think, is only 2% are going to Wikipedia. And I know you have some thoughts on that.
Yeah, it's a little unsafe in certain environments. So you want to go to someone who's got a good medical background, or they're actually doing some evidence or making sure clinicians are looking over the science that's being displayed out there. Again, I've always told people a little bit of knowledge is dangerous, so it's okay to understand things. But once you get an idea where you want to go, it's a good idea to ask a professional.
Well, before we get into the pros and cons and what are the good websites, let's talk a little bit about the background. Why do you think this is not just accessibility? Obviously, we have smartphones and iPads and computers, but why do you think people are so quick to want to go to the internet?
I think there's a lot of reasons. I think some of it's avoidance and just the convenience of being able to access things and to think through things. I mean, we're all inquisitive. Most of us want to know and understand things. So it's just human nature, I think, to want to be in control. As parents, obviously, we're in control of our children. So one of the hardest things we have to do is to admit that we're wrong also. So it's challenging. But I think convenience is a big one. I think there's probably a cost avoidance with this. Some people don't want to pay to go to the doctor. And, that's real. It's not cheap. I unfortunately have to run a business and we have to charge, and the government tells me what I can charge, but again, those things are all challenging, and so I think there's cost. And then I also just think people really want control. They want control of their destination, which I encourage. I think there's a big movement right now for patient engagement, getting patients much more involved in their care. I know in Boston they've done some outstanding things with their informatics platforms to help that. But engagement, knowledge is very good, but you also have to understand knowledge requires experience and application. And I think a little bit of knowledge again could be dangerous, especially when you're dealing with health issues that could potentially delay care if you don't seek help soon.
I know as a nurse, I've given it some thought, and I know you've said people don't want to wait. They want to know quickly what's going on, and there's an app for that. Well, there's got to be a place I can look this up and get the answer. And then you mentioned the cost, and even co-pays now.
Sure.
It can be challenging for people financially. And also the thing of sometimes calling to get an appointment, it can take some time. And I guess some people are thinking, I can't wait this long. I need to get this taken care of. So we definitely know there's a lot of reasons for it. And I think there might be a bit of you mentioned curiosity.
Yeah, well, my adult children have taught me how to use YouTube to fix engines and to change things. Everybody's always publishing a how-to, and I even, you watch DIY channels, these home fixer-uppers, etc. So everybody has the desire to do it themselves, whether it's for cost, convenience, or just wanting to do it. Wanting to be a knowledge-based individual and to say, hey, I fix this myself. So there is that independence, and I think that drives more of it than actually the cost or the avoidance. And then there's some people, healthcare is not always the most comfortable situation, so we tend to not want to ask questions about private things. So there is that privacy issue that I think people are fearful of, but there's not too many things I haven't heard in 20 plus years of medicine that would surprise me. And again, asking somebody who's got an experience dealing with a very private issue 1,000 times versus just your first time actually understanding it is probably a better avenue.
Well, we'll talk about this as far as, it is appropriate to look some things up, but you also have to know there's a fine line of when it is time to see a doctor, and many of the reputable sites have disclaimers on them about, well, if you have this symptom for this long, then it's time to see a doctor, and they really should do that, of course, and we'll go through some examples. But I guess the other thing I was reading in the literature is, we have people that are always looking for, this must be a disease, and sometimes many things are minor things. Like not every twitch, is ALS, and not every tremor is Parkinson's, and yet when people have chest pain, they should definitely call 911. So let's talk about some examples, I guess, of things you may have seen or with some good advice on how to use the internet, and should people go directly to WebMD and those kind of sites versus just Googling, and you can get a variety of things that pop up.
Yeah, we talked earlier. I actually Google things myself just to see what patients are getting when they ask me questions. I encourage patients to actually go look things up and utilize the tools that are out there, but using a reputable like WebMD or the Mayo Clinic or Cleveland Clinic, healthcare-based websites is probably safer, and really reading through the guidance of things. But I think that, I'll give you a great example. You have blood in your stool, you're 50 years old. If you ping that one, you're going to find recommendations and guidelines for colonoscopy, which is great. It may help guide you to get that colonoscopy. So there are some very positive things you can get out of this, and I encourage people to go read about it, and then maybe guide your primary care doctor, nurse practitioner, or there's even helplines now you can call where you can talk to an RN or a nurse practitioner or mid-level before getting to the doctor. Just run over your symptoms with them and find out what's your best approach so you can get the answer as quickly as possible.
Well, I think that is a good example about blood in the stool, because it can be something as simple as hemorrhoids.
Absolutely.
Yet in a younger person oftentimes, or if there's a family history, that would definitely say, time for a colonoscopy if you haven't already had one.
Yeah, most definitely. And there's, blood and urine. Blood's one of those things that everybody gets concerned about. Bleeding to me, I always tell my wife, bleeding to me is a little different than what it is to her. So I've seen a lot of bleeding. But again, a small amount of blood could really guide you in the right direction to get evaluated. And there's plenty of guidance out there in those elements. There's a ton of other examples. Coughing, for example, is one of those or headaches. Headaches scare people to death. They think they have the brain tumor. Again, 20 years I've been hearing that even prior to the internet being very available. But headaches are one of those things too. There's a million causes for it. And it really requires a good history and physical exam for us to determine whether it's right or wrong as far as going down the right differential.
Well, I guess let's talk about what the biggest problem can be. I saw an interesting term in one of the articles on the internet, of course, called cyberchondria, where people can just always think the worst by looking on the internet for information. So when is it appropriate to see a doctor, or how should someone discern that? Because I think when we were talking before the program, the biggest side effect or problem with this is delaying care. Yeah. Someone that delays getting seen in either the ER or calling their primary care physician. And of course, you have to be careful with going to the ER too. Not everything requires an emergency room visit. So talk about that.
Yeah, I think there's truly a new revelation of these folks who are out there who do think the worst. I know I've dealt with it in my own family as a doctor. I look at my family when they come to me, and I do not treat my family because I'm not objective with them. And when I hear something, I always think the worst, especially when it comes to family. So clearly, in a personal sense, I can't imagine without my knowledge making those decisions. It would be very scary for you to even have the insight to try to treat something, without having consulted with somebody who could be objective. Because it's important you see it in the eyes of a totally unbiased view to make sure you're getting the best diagnosis. I think these cyberchondriacs are real. In fact, we see them regularly. There are multiple visits in the ERs. They really have potentially some other issues that may be going on, which could be psychiatric also. But you give the wrong person the wrong information, they could really make some drastic changes. Using bleach on skin lesions, for example, or applying certain antidotes to taking medication that may not be evidence-based, and it can get really dangerous if you're making those kind of decisions without practice with dealing with those things.
Now, one thing I did want to mention is what can doctors do to help the situation? And I think one thing you already mentioned is you do some research on your own on what's out there, so you're kind of prepared for what people might bring to you as, oh, I have this symptom, it must be this, and then you kind of know what they're seeing. I think that's very important.
Yeah, curiosity again is, I'm always curious to see what the customer sees. And honestly, as a patient, it's important that when you do look, that we get to kind of be able to ping the internet. And I am happy to say I do see very reputable websites come up, but then as you get further down in your Google search, it gets a little sketchy as to what's out there. So you just have to be careful what source you're getting it from. Even in medicine, as we're trained to be physicians, sourcing of evidence is very important. In the pharmaceutical industry, if it's a drug study that's done by a pharmaceutical company, most doctors will not find that as reputable because of the value-based.
Well, they have a vested interest
absolutely.
In that drug getting approved.
So you could clearly find bias in their study and research. So even from a very highly technical scientific standpoint, you really have to understand the source of the information you're getting things from.
Because I guess you're right. You kind of should welcome patients taking more of an interest in their health and their care and,
Sure.
and educating themselves. So being a good listener, I imagine, is important first, and then know what they're probably bringing to you, and then of course refer them to some of the more reputable websites. Don't just do a Google search. It'd be best, wouldn't it, if they went to just Mayo Clinic or Webmd? Because sometimes those Google searches, you get all kinds of things.
You do, and I welcome patients, even the most patients with the most significant questions. I ask them to bring in what they're looking at. I want to see it because we can correct it or hopefully help guide it. And then the other thing is, like you say, being a good listener, just asking the right question as to, so what's really bothering you? Why are you looking this up? Maybe it's something totally off base. And again, there's a lot of medical terminology that people don't understand that clearly could really mislead them down the road of, boy, what was that word? And then they're looking up synonyms, and oh my, it can just go on and on and on and on. So you can dig yourself a pretty big hole, and then before you know it, you're having panic attacks and can't sleep at night because you're going to die from something you don't even have. And that's really a disservice to yourself. That's where you need to get evaluated sooner than later. I'm hoping we see more of these helplines in the future where people can actually seek medical advice, at least guidance or navigation through the community to get into the right people at the right time, because so many people go to the wrong providers. I know I help guide my family regularly. I get phone calls from people all over the country. So if you do have a healthcare provider in your family, take advantage. If you don't, those are the folks we really need to get some assistance to.
Right, and if you do go to the more reputable sites, I know most of them are very clear on
Absolutely.
If you have this long, or if you have this for just 5 minutes, call 911, or chest pain and signs of a stroke, and we are trying to educate the community about facial droop and speech problems, and if that's happening, call 911 and the chest pain and so on. So
yeah, there's certain things that are really ominous and need evaluation and should have no delay to them. But that's the minority in most cases.
Right.
So, but those are the ones that really have very specific signs and symptoms that should drive you to seek professional help quickly.
Yeah, I guess the other one that gets tricky is abdominal pain, you know, because depending on how severe it is, and pain's what you say it is, and how severe is it, and when should you go to the ER if there's abdominal pain, or do you call the doctor first, or, you know, that can get tricky, I think.
Well, most people who understand what we do for a living, we're basically detectives. So, you know, the best thing you can do with things like abdominal pain, pain in general, is keep a log of it when you have the pain, when it goes away, what makes it better, what makes it worse. So those symptoms and questions, and you'll notice when you see doctors, we tend to ask a lot of questions. Historical questions, a lot of it's repetitive, but a lot of it's appropriate based on what your symptom is or are. So there's multiple, you know, ways you can skin a cat with that. You really have to identify the chief complaint and work your way down the line. But there's a ton of stuff that really needs an objective assessment, and I see all the time where families present in the emergency room and they've already labeled the patient and they're missed the boat by you know, again, and as providers we miss the boat too. So we usually go down one path based on what we were given as symptoms, and then we may get more information. So it's an information gathering tool that we utilize, and it takes a lot of practice to get that information right.
Well, then let's talk more about, I know you kind of alluded to this earlier, is there are some changes going on in medicine, and PRMC is getting involved in some of these as far as changing over to a new charting system, and talk about what PRMC is doing with regards to like telemedicine, where people can actually be diagnosed through a video on their phone type of thing. Tell us what's going on in that area.
Right. After November 1st, we've actually purchased an EMR, new electronic medical record called Epic, which will be community-wide. It's probably it's the #1 worldwide vendor. Very good tool, very powerful tool, very for sharing clinical information. But on the patient side, it has a wonderful tool called MyChart, which we'll be implementing in November also. It gives people ability to access their records, their results, their medications, and in the future it'll also be allowing us, and future probably not long after our go live, probably sometime in January or after that in 17, we'll be able to actually do video visits. We'll be able to do e-visits. You'll be able to establish appointments with your providers, and then get information too. So it should be another way you can access medical people to help you guide you through your questions. And to me, that's just, again, the more we can engage patients, the more we can engage families and caregivers of those patients into their environment, we're going to be reaching our fingers out into the community and hopefully helping folks connect better to their medical needs.
So do you see down the road, you know, in addition to all the medical record piece and such, where doctors will be seeing patients, you know, virtually, and if you have video, they can show you their symptoms, if it's a tremor or if it's, you know, issues like that, and where would that come in handy?
So one example, we have a relationship with Washington Children's Hospital. Our hospital-based pediatricians are employed by them. We contract with them. They have a world of subspecialists up there, a neurologist, for example, I met the other day, who is willing to do video visits with patients and their families. As a pediatrician, they can really gain a lot of information about watching the behavior of the child, even using video cams on your phone. So having video meetings and appointments with these providers who aren't accessible in our small community here, we can get some of those big city tertiary care folks to help us identify maybe problems, needs, or guide us down what's best practice for that type of disorder. So there's a lot of potential in the future, even doing common cold visits in the office with your providers to avoid you having to go to the office and maybe giving us a little more security that things are okay on the other end of the line too. So the phones have really opened up the world and the video capabilities for us to do those and have those interactions. But we'll be doing that in 2017, which we're really excited about.
Yeah, that is exciting. I guess there's something to be said, especially with kids, not taking them to the pediatrician's office or whatnot, where you're surrounded by germs and so on, if you can diagnose something. But I guess at the same time, you know, hands-on examination is oftentimes what's necessary.
There's appropriate things you can do with the video visits, but then there's also inappropriate, and those we'll still have to bring you in and do our thing.
So what about the role of nurses? I know you mentioned like you can call the primary provider office and oftentimes speak to a nurse first who can ask you some of those questions that determines time to come see a doctor, or no, do this, try this first, call back in a few days.
Yeah, we actually have a nurse call program currently that's just started up, so that'll be enhanced more with our new EMR in November, because they'll have more accessibility to your clinical records. Yeah, there's a lot of potential for nurse call availability. Again, our community is very under-resourced from a standpoint of healthcare management. The hospital, we have 4 walls, but we need a lot more fingers out in the community so we can touch folks who need access to healthcare, and getting nurses out there to at least help screen or guide you or become navigators for your care, because it's difficult. What we do is extremely complicated. It's very dynamic, very elusive, and if you're not engaged in it and not able to get the information you need, you could go down the wrong path, which could delay care.
Yeah, we don't want that. I mean, in many
that's what we're
cases,
avoiding.
it can be very dangerous to delay care. I guess in the perfect world, you have very knowledgeable, accessible physicians that, of course, are basing their care and diagnosis on evidence, research-based evidence. And then, of course, it also takes a patient who is informed. But, just go to the reputable websites, I guess. Let's, just emphasize some key points for people in our community. What websites would you recommend that people use that they can have the information and come in informed, asking the right questions? Because many people are still intimidated, by seeing a doctor, and they're afraid to ask questions. And I know as a nurse, we try to advocate for the patient and say, make a list before you go so you make sure you don't forget or get nervous and that kind of thing.
Well, again, back to the questions we typically are looking for. We're looking for more symptom-based guidance from patients. I'm not necessarily looking for a diagnosis from the patient. Hopefully that's what I'm there for. But I am looking for symptom-based things, so documenting your logs of when your symptoms are or are not present. If you've gone online and you have concerns about something, bring it to us. Educate us on it. And again, bringing a learning tree document to a physician is probably not the best thing, but bringing something from Mayo or from Cleveland Clinic, Hopkins has a great access. Our new EMR will also have some new tools that will give you access when you're on your phone with MyChart, that you'll be able to actually pull out some of those elements of care, and it'll actually guide you down an e-visit, asking you the proper questions on an online format. So when I get the message, I'll already have kind of a baseline of where we need to go. And whether you need to come in or not. So again, that's going to be kind of the communication tools that are out there. But I think any website you go to, I said it before, the source is so important. Make sure it's a reputable facility, organization, and it's not just a non-evidence-based website, because the science is very important. But the biggest thing we need from patients is a good symptom history. That's so important, and then having your medications available and all those other resources.
So keeping a log, yet of course there are certain symptoms. You're not going to sit around and keep track. Well, I'm having chest pain now. I'm having, speech problems. I need to go to call 911.
Correct.
So I guess, it's a lot to ask of a person, but they should go to a reputable website, and they will all say, tell you what to do. And of course, mention, see a doctor if it lasts this long, or if you have this symptom, call 911. And so the reputable websites would take care of that.
Yeah, most of it's just a guide. Just a guide to get you into the right place. It's a navigation. It's finding out who you need to see based on what you have as far as symptoms.
And it's exciting about what's going on at Peninsula Regional with all these technology changes.
We're very excited. It's challenging. It's a big project, but hopefully the emergency room, the interesting thing about it is that the entire medical community under PRMC's umbrella will have access to this, so there will be continuity of documentation. So all the patients' histories, et cetera, will be there when we need it. And that's the value of it. And Epic's got a wonderful history. University of Maryland, Hopkins, Anne Arundel, Inova, number of facilities in the state or in our outreach area, Mercy up in Baltimore, all have the same tool, and we'll have interaction with them also. So it's pretty amazing. I know 20 years ago when I started practice, I never envisioned the ability for me to see so much information about a patient when I need it. But it's going to be remarkable, and it really does help guide us, because we're not asking all the questions as to, well, what happened last week. I'll be able to actually go see a clinical tool.
Yeah,
it's
coordinated
powerful.
care, nothing wrong with that, right?
Interoperability and just, again, giving the providers the information they need to give you the best care possible.
Yeah, confidentially so. I think people
Absolutely.
get nervous about accessibility of information too. So there's a lot of issues here, but I think at the end of the day, it could mean, better care for everyone.
Most definitely.
Well, thank you so much for being on the program, and we'll post some of these reputable websites that you recommend at the end of the program to give people go directly to that perhaps versus just Googling it, and hopefully we'll educate our viewers as well.
Yep, well, thank you. Thanks for doing this.
And thank you for joining us for this edition of Focus on Health here on PAC 14.